Welcome to the State of Calamity show. Today, we're going to talk about data. Data on death, data on dying. Data as presented on the 24/7 real-time death trackers featured on major international news networks. The news in many countries, including America, is reporting positive coronavirus test results as well as deaths resulting from the novel coronavirus, but they are not reporting recoveries in the same tracker console. Why is it that US-based news networks with subsidiaries and broadcast presence outside of the US are showing recoveries from the novel coronavirus in their death trackers? We could even call those recovery trackers. For example, I tuned in to CNN Philippines yesterday, and they were showing positive results, deaths, and also recoveries on the screen of CNN Philippines. The same death tracker console in CNN Philippines was also showing recoveries, while as in CNN US, it was only showing positive cases and deaths, no recoveries. In the Philippines, that was not Philippine-specific information. It was the same layout as you'd see on CNN in America, with the global results and the US results. It was not Philippine-specific, which leads me to the conclusion that CNN in America also does have the recovery data, but is choosing not to include it. It's very interesting. Are there underlying motives to making this pandemic appear as bad and grim and awful and utterly hopeless as possible? Is that driving up ratings? Is the goal to instill so much fear that everybody is glued to the news 24/7, sleepless nights, living in panic, blood pressure soaring, stress levels at their all-time high? It's almost like expecting a nuclear missile to land at any moment. We do not mean to understate the severity of COVID-19, the pandemic, and the need to be very cautious at all times, to follow all guidance from the World Health Organization, the CDC, and your local health authorities. It's very serious, and we must take all precautions to prevent infection and transmission. Wearing face masks appropriately, hand washing, using alcohol if available, or making home options. And you can find information on how to do that on the World Health Organization website and your local health authorities as well. So obviously, we must take this very seriously. It is a serious situation, a serious pandemic resulting in mass tragedy and death. However, do we really need to only focus on the negative? Why not turn that console into a recovery console and show that the majority of those infected are in fact recovering? What I hope to accomplish during this broadcast is to help with perspective. Coronavirus deaths as of April 6th, 2020 at 6:23 a.m. East Coast time. The death trackers are changing by the minute, so we've got to take a slice of time to look at 69,555 deaths and 1,277,972 positive tests for the novel coronavirus COVID-19. Very large numbers and very scary numbers, especially when you watch them increasing minute by minute by minute on your TV screen or on your smartphone. The first case, technically December 2019 in Wuhan, China, apparently. Now, even if you take all the cases of novel coronavirus that led to deaths, and you put those into a single month, to be as grim as possible, coinciding with what mainstream media seems to be doing. So we take the 69,555 fatalities from COVID-19, and we assume those all happened in a 30-day period of time, so as to frame this as hopeless and grim as possible, just for the sake of perspective. If we were to do that, we would end up with, as I run the calculations, we would end up with a total of 2,318 deaths per day, assuming all of those 69,000 occurred over 1 month. Obviously, that's a lot of deaths, and that's a lot of tragedy, and we are not making light of that in any way. But for the sake of perspective, let's talk about the flu. The flu has been around a very long time, as we all know, and the flu also features vaccines, which the novel coronavirus does not yet. The flu is killing up to 1,769 people worldwide per day. That is a huge number per day, even though there is a vaccine. And in terms of the severe cases per day that are, in fact, diagnosed, up to 13,698 per day diagnoses of severe cases of the flu. Now, let's shift gears for a second to malaria. Malaria takes 1,109 lives per day. However, 200 million people per year catch malaria. That's 547,945 people per day catch malaria according to the World Health Organization. Imagine if we had a tracker for malaria. Suicide takes the lives of 2,191 per day. Road accidents, over 3,600 per day. HIV and AIDS-related illnesses, 2,100 per day. Alcohol, 8,200 per day. Smoking, 19,000 deaths per day. Secondhand smoke exposure, 3,200 per day. Cancer, 26,000 per day. It's expected to reach 41,000 per day sometime in 2020, which is the year now. Diabetes takes the lives of 4,300 plus per day. Heart disease, 49,000 per day, probably higher because of all of the panic in society and throughout humanity at this time. So for the sake of perspective, it's important to understand that. One thing that I want to talk about that might surprise you, let's talk about one of the most dangerous creatures in the world, which you may not have expected, mosquitoes. Well, in fact, mosquitoes kill 1,986 people per day, making them one of the biggest silent killers anywhere. So for the sake of perspective, although the novel coronavirus is a horrendous, serious problem that we must take all precautions to prevent, it's important to also understand that 725,000 people per year are killed by mosquitoes, which includes malaria, dengue, and Zika. In fact, mosquitoes kill more people in a day than sharks have killed in the last 10 years. Statistically speaking, you're better off swimming with a shark than facing a swarm of mosquitoes, although I think I would choose mosquitoes personally in that case. So in closing, while please understand we do not wish to undermine how serious the coronavirus is, and just as we shouldn't swim with sharks and we shouldn't run barefooted through swarms of mosquitoes, and we shouldn't smoke, and we should drive safely, and we should do all things possible to avoid cancer and diabetes and heart disease and eat healthy and exercise. We should also do all things possible to avoid exposure to the novel coronavirus. Social isolation, for example, following all of the suggestions. Many people ignore and are gathering in large groups when they certainly should not be right now. And so it's important to understand that while the novel coronavirus is certainly serious, if we had a death tracker for all of these other conditions, if we had a channel that just broadcasts mosquito deaths on an hourly basis, I suppose we'd all live in fear, wondering when that next mosquito was going to somehow slip under the door through the vent and bite you, and you'd be one of those 1,109 people per day that dies from a mosquito. So obviously it is a time to be concerned, it is a time to take precautions, but it is also time to understand that there is plenty of hope, plenty of optimism. There are lots of causes of fatalities around the globe, not to mention the one that we didn't yet discuss, which is people taking the lives of people, 1,095 per day. Even that is not broadcast on a death tracker on the news showing every time somebody's killed by another person. So I hope this message has helped provide some perspective. I realize it may not be uplifting talking about data and death and dying. However, please keep in mind that for as long as we've all been alive, far more have died from all of these causes than have died from the novel coronavirus, except for sharks, which on average are killing 6 humans per year. Mosquitoes are the real villain here, not the novel coronavirus. Thank you for joining. We appreciate your time very much. Be safe, and thank you for listening to the State of Calamity Show.